Hi everyone, Ginger Garner here for another pose of the week. I had a great question from Pam who asked what is happening in the hip and the knee in half lotus and lotus poses. The first thing that I want to mention about those poses is that I don't use them as a therapist. There are many other more sustainable poses out there. So the short answer is I don't use these therapeutically at all because my mission as a physical therapist, as an athletic trainer, is to create a sustainable practice of yoga. And lotus and half lotus isn't necessarily sustainable, especially for the population that I work with that has hip problems and pelvic issues. The second part to that answer is if you just have to do lotus and half lotus, ask yourself this question. Just because you can, does it mean you should, right? And I always ask myself that question with a yoga pose. Just because I can do the yoga pose doesn't necessarily mean I should. Should I do that? So for me and for the patients and students that I see, the vast majority of them, the answer is no. They're not appropriate. Could they do them? Yes. Is it sustainable? No. So my mission is to make your practice safe and sustainable and effective in a more efficient way. So a couple of things. First, you want to make sure that you have enough external rotation in the hip to be able to even do this pose. You should have an equal amount, roughly, of external to internal rotation. And people who don't have that equal amount, and they're erring towards not having the hip external rotation, I would not do this pose with them, okay? Or yourself, if it's you. And the other piece of that is looking at their safety on their rotation in their tibia, because people with knee osteoarthritis do have a common characteristic of excessive external rotation in the knee. So let me show you what those two things mean. First, you need to look at your hip external rotation and internal rotation. So you're going to have them lay on their stomach. Let the legs fall out to the side, internal rotation, and let the legs come to the other direction, external rotation. Internal rotation, external rotation. So this pose doesn't work for me. I don't have a lot of external rotation, as you can see. If you don't have a lot of external rotation, I would ditch the pose. Second, look at your tibia. Now, the specifics on this is you need to be able to find your joint line. So here's your joint line. Okay, there's a little divot. Find your joint line. Pop your toes up. Turn your leg out. Now keep your foot still. You're actually rotating from the top of your leg, right? External rotation, internal rotation. External rotation, internal rotation. You would do that on both sides, just like you did for the hip. If a person has a lot of tibial external rotation, then you may not necessarily want them going into this pose either, okay? Or if it's yourself. So if I'm going to stay in an easy seated pose for a long time, I would add blocks under my knees. Okay, this is more like a tailor sit, less like an easy seated pose, more formal sukhasana, if you will. If a person is going to go into half lotus, I would have to make sure that first they have enough external rotation in the hips, right? If they don't, then this pose isn't necessary. Sit in thunderbolt, okay? That's a different way of doing your seated meditation. And I would encourage you that if you are a chair dweller, a desk dweller all day, I often have to be myself, then seated meditation is not really a good fit because now you're just sitting all day at work and then sitting for your meditation too. Go take a walking meditation. Recalibrate your idea of what meditation is. It does not have to be seated at all. If they have enough adequate external rotation, and this is comfortable for me, then if I was going to come up into half lotus, I would not just wrench the leg up. That's going to create tension up here. I would cradle the leg like a baby. There's a reason for that. Create a sense of safety in the leg. And then make sure that as I bring my leg up, which I'm not going to demonstrate because I don't do the pose, to create sustainability through my own hips and knees so that I can avoid joint replacements one day and injury. Okay, that would lead to that. Then I would cradle the leg up as I come up into that position and make sure that the structures up here stay at ease. The second thing, okay, so there's two major points, hip and knee. The second thing, knee. Make sure that if you're coming up into this position that you're not cranking the leg into all that tibial external rotation here, that you're keeping it not in a neutral, it's not going to stay in neutral, you'll get external rotation. Okay? You just don't want to crank it all the way out there to the end and then crank your hip rotation, external rotation all the way out to the end. I hope this has been a help to you to create a more safe and sustainable lotus and half lotus if you're going to do these poses. If you are missing hip external rotation, I would encourage you not to do the pose. If you have an excessive amount of tibial external rotation and you already have knee or ankle issues, then I would also have you exclude this pose from your yoga practice. And of course, if you have any hip labral issues or impingement, this is also a set of poses to steer clear of, because if you're missing any range and then you continuously crank the leg up into half lotus, even just half lotus, then you're really stressing the cartilage, the protective mechanism in the hip that gives the hip its what's called a distraction and compressive stability, okay? So I hope this has been a help. This is just kind of a scratch the surface about half lotus and lotus pose. Please send any other questions you have my way. You can follow me on Instagram and on Facebook at Dr. Ginger Garner. Happy to take your questions. Happy practicing, and I'll see you next time.